It's not bad, buddy.
On this episode of Bondi Vet,
Look like a bit of overkill there.
I'm going into a tiger's den.
Scott battles to save the life of a very prickly patient.
As if it is a fracture, unfortunately, this hedgehog won't survive.
Far out, you're crazy, kitty.
Can Lisa treat a crazy cat that's totally out of control?
He is seriously angry and we cannot get near him. He could really hurt someone.
So what's happened?
He was hit by a car.
And Chris lends the long arm of the law a helping hand.
He's tinged with blood, so that is a bit of a worry.
You make my world a better place.
Come on, there's your girl.
I can depend on you.
Where are you? Hello, little one.
At his Richmond practice, Scott is starting off his day with a rather prickly patient.
Look like a bit of overkill there.
It does look like overkill. I'm going into a tiger's den, not to pick up a hedgehog. Hedgehogs are prickly, they are quite sharp, and I do need to protect these important hands. There he is, so balling up nicely, which is the perfect protectionist move, but also makes it quite difficult to examine him.
Yeah.
The adult hedgehog was rescued by a local wildlife carer who's worried it has a serious infection.
It's always really nice when we get wildlife into the practice. It's nice to give back. This one has an abscess somewhere on its body. I got into being a veterinary surgeon because of my passion for wildlife, and I was that kid that used to run around the local neighbourhood scooping up all the injured wildlife and bringing them home. So it's really important that in my current job I'm still able to look after wildlife. Just a bit of a swelling there, so I don't know if that might be the problem, but we need to get him to stop furling. You can let me have a look? No. All right, so we're going to have to give him a little bit of gas and just see where the infection is. So what we're doing here is we're using an oxygen chamber, but we're actually using it to gas this guy down. Because they furl, they kind of cover their face, so we can't actually put a mask on them. So we have to gas them down like this, and then they'll open up, and then we can put a mask on.
But as he's putting his patient to sleep,
Maz? Yeah? Do you want to come and have a look at this?
Scott wants to share something he's noticed with his practice manager, Maz.
Ah, look, hedgehog tummy. It's like Maz. Look, it's prickly on the outside, but all soft in the middle.
Thank you. I thought I'd pick some stuff up from there over the years.
Yeah. My relationship with Maz is great. She is my sister-in-law, which should normally mean that we have a frosty disregard for each other, but actually we get on absolutely brilliantly. She is so much fun, she's got so much passion and energy, and she absolutely loves animals. Now that we've got our hedgehog unfurled, first of all we can say that it's a girl, so we're going to call her Maz. But what we can see on this right hind leg is just basically on the top of her ankle. She's got a very deep wound. There's a lot of swelling. So I'm hoping that it's infection rather than a fracture, because if it is a fracture, being that there's an open wound, unfortunately, this hedgehog won't survive. Quite concerned about the hedgehog's leg. It looks quite infected, it looks quite swollen, and the chance of it responding to orthopedic surgery is quite low.
An X-ray will decide whether Scott is able to treat the injury. If not, the poor little rescue animal will have to be put down.
X-ray. So there's a wound there. That's really, really great news. So you can see there that the bone's all intact, so that's really good news. There isn't any fractures. I can see where the little deficit of skin is, but underneath all the bones there are perfectly formed. There isn't any breaks. Oh no.
But the good news is soured when Scott examines the hedgehog's torso.
Dislocated hip. It's not great. It's going to be really I'll try and replace it, but I think the chances aren't very good.
Despite the risks, only surgery can now save the little hedgehog.
That's the femur, and there's the femoral head, and it's supposed to be a ball and socket. So there's the ball and there's the socket. Unlike the left side where you can see there's the ball and there's the socket. Unfortunately, I will have to perform a femoral head and neck excision where I remove the end of the femur so that the femur no longer attaches to the pelvis, but being a light little animal with good musculature, hopefully it should still be able to use its leg. They will grow back, of course. They're just like hair, very thick hair. It's where eye protection. Yeah. Bing, bing, bing. Okay. I'm hoping that surgery will go well, and if it does, that means that I'll never see Maz in the surgery ever again. Here we go. It's quite distressing when you realise that your patient will never be the same again after an injury as before it. And in Maz's case, the problem here is that the hip is dislocated, so I will need to remove the femoral head, basically allowing for a free floating hip joint, but it does mean that little Maz will never be the same again. After dissecting all the musculature, I've now managed to get down to the hip joint. I now can see the ball of the ball and socket joint, the femoral head. So I need to take that away just so there's no longer any contact between the pelvis and Maz's right hind leg. It's really fiddly. It's like you're doing surgery on a chicken almost. Performing surgery on Maz, and her bones are tiny, they're very fine, they're very fragile, and you need to be incredibly careful. So there you go, that's the femoral head, that's the top of the right leg, and now that right leg is no longer attached to the hip, so hopefully no more pain, and this little lady will start to build up muscle and strengthen that leg again. Okay, and that's it. All right, let's turn her off. The surgery on Maz is a complete success, and now the leg is free floating, and I'm very hopeful that this little plucky creature will recuperate from her injuries and make a full recovery. Waking up.
Without surgery, Maz the hedgehog would have had no chance of survival against predators.
Oh. So this is the hedgehog we called Maz.
She's very cute.
She's so cute. So a little bit of TLC and little Maz can be released back to the garden that she came from.
To survive and thrive. Like all good Mazes do.
Just like you, likes to nap during the day.
Yeah, oh, it's making me tired.
Right, now should we go and put this one back to bed? Maybe you and Maz can have a little day nap. Go and have a snooze together. Come on.
Matt. Come on, Matt.
As a vet, the best advice that I can give pet owners is this. Think carefully about the choices that you make on behalf of your pet, and you can literally save their lives. And if you make healthy choices, you will have a healthier pet.
On my way to Maroopah Police Station, we just had a call that a dog's been hit by a car. Sounds like quite a young dog, a puppy. It's bleeding from its nose. That's really all we know at this stage. Not the best place for an illegal U-turn in front of a police station. I hope they'll understand. Hi, how are you? Can we go in here? Is that okay?
Yeah, sure.
So what's happened?
He was hit by a car.
Yeah.
He was coughing when he came in, and he's got a bit of a bloody nose.
Okay.
The injured puppy was found with his brother on the side of the road. Fortunately, the other boxer is unharmed.
They looked pretty sad and miserable. We don't know how long they've been out there on their own, so it's pretty sad to know that two little puppies have been roaming the streets.
So this is what he's bringing up here, and it is tinged with blood. So my feeling is he's certainly aspirated some blood, either through the trauma or as a result of the bleeding going down into his airway. So That is a bit of a worry. You're getting released from the station. No charges. Let's go. Any names that you've been giving him?
No, we haven't named them yet.
Okay.
No.
All right. Okay, well, I'll let you know how we go.
Okay.
But thanks for doing what you've done. It's great. Okay.
It's after midnight when Chris arrives back at the Bondi clinic.
But you didn't expect your night to end up like this, did you, huh? That makes the three of us. What have you guys been up to, huh? You gonna come clean? Hey? It's been an adventure, hasn't it? Wow. So he's got a tapeworm.
Ooh.
He's just dropped out here.
Wow.
All right, his temperature's normal. It's about the only normal thing about this case. I just want to check out his chest and just see where this blood's coming from.
Sure.
Because if that continues and builds up, then he's going to have some real trouble breathing. Hey, buddy, I'm just going to leave you for a second, all right? X-ray. So he certainly does have some blood around the base of his heart there, and that's what he's trying to bring up when he does that coughing effort. The plan for him right now really has to be to try to reverse these signs we're seeing now. We'll have to really stop any potential future blood loss into that chest of his, and then secondarily try to replace the fluid that he has lost through the blood. So we're going to give him a drug to stop the bleeding and then put him on some fluids as well. If we can do all of those things tonight, then hopefully we'll see a different dog in the morning. He just shouldn't look like this. Morning.
Next day, Chris is in early to check on the two boxer pups he rescued last night from the Maroubra police station.
No more coughing, it's good. It's very good. You might be getting better. We don't know who you belong to and we don't know your names. So, what we need to sort out is who you are. So I was thinking, Bruce and Barry. The bad boys from the bra. How about that? Oh, Bruce, you're with it now, are you? Geez, do you get the feeling they're hungry? It does make you wonder how long they have been roaming the streets.
After breakfast, hit-run victim Barry has recovered enough to head outside for some fresh air with his brother.
Been a little bit of wriggling going on, which tells me that we may have had some improvement. It's obviously sad that these two pups now are essentially orphans. I mean, there could very well be a family out there that's heartbroken, but because they don't have microchips, there's just no way of being able to track them down. I would just hate the idea of these two brothers ending up in an animal shelter and being split up. So we're going to do everything we can to stop that from happening. They've never had a bath before.
You can smell that.
Yeah.
Barry and Bruce are getting a makeover.
Barry.
Don't eat the soap.
They seem to be really relishing every touch they get. It makes you wonder whether they really ever had much of it.
Sadly, no one has claimed the stray brothers.
You don't look so tough right now, Barry.
But Chris has a plan.
Brucey. It's not bad, buddy. Look at that. Need the hard sell on these boys, Neil.
I know we're going to get them home somehow by hook or by crook.
Yeah? It can't be too hard. Look at that.
Oh no, a face like that, who's going to say no?
Well, who can say no to a bad boy, huh?
I can't say no to a bad boy.
Are you going to send the emails now, are you? Barry seeks loving new home. Close to transport. We'll find a home for them. You got to think it has to be a good home. I'm confident we'll get something. We've got some big news, all right? Some very exciting news, some happy news.
It's a big day for Bruce and Barry.
You're going to say, hi, Bruce.
Chris's campaign to find them new owners has worked, but they will be going their separate ways.
This is going to be tough. It's going to be tough on them. It's going to be a little bit tough on me too.
Hi, doggy.
Look at them.
There's Bruce. And his brother Barry.
Bruce is being adopted by Nick, May and their daughter Priya.
I would have loved to have found Bruce and Barry the one home so they could stay together and be brothers forever. But the reality is 2 boxes in the one house would be more than a handful. But we have 2 separate homes, both very loving families. They'll be happy.
Say bye, Priya.
Bye-bye.
Bye. Priya.
Don't feel left out, Barry. We haven't forgotten about you.
Barry, don't look so sad. It's going to be okay, mate. You've got a very special home too. Just one important thing. Always respect your elders, okay? Look!
Hello.
Hey Adrian, how are you?
Good, thank
Good to
you.
see you.
Oh,
It's Barry.
Barry, hello.
Barry, meet Tosca.
I think it's going to be good for Tosca. She was been moping a lot, and so now I think she's got a companion.
It has been a big day, saying goodbye to Bruce and now to Barry, and you can't help but start to connect with them. You can't adopt them all. Otherwise, I'd have about 400.
Hi, kitty. I know you're scared and sore.
A frightened cat has been rushed into the Bondi Referral Hospital sash with a suspected snake bite.
How are we going to handle you?
But examining Dougal is going to be very difficult.
Gives me a fright every time. This cat has apparently been found next to a black snake, and according to the owners, he's got a swelling on his face. The problem is he is seriously angry and we cannot get near him. Far out, you're crazy, kitty. This is not funny because snake bites are actually really serious, but Dougal's owners are refusing to appear on camera. I think they're embarrassed by his behaviour. Well, he's in there.
You're going to be fun, aren't you?
So I think our only option is to give him an anaesthetic with gas.
Lisa now has to get Dougal into the anaesthetic chamber.
We should have a first aid kit.
The question is, can the team do it without casualties?
Dougal is nuts. He could really hurt someone. He is a shredding machine.
Got him?
Yep. Alright, let you have it. Ah, takes 3 people to wrestle a 5-kilo cat. Isn't that just great? It's taken a few minutes, but Dougal is finally under my control, and now I can actually start looking for the bite site. But the problem is we've already lost valuable time, and if Dougal has been bitten by a black snake, then that venom is already attacking his system. I think we've definitely got some soft swelling over here, and 2 puncture wounds over there.
With puncture wounds found, Lisa has the evidence she needs to start giving Dougal the anti-venom treatment.
Give him 5 minutes for those meds to kick in. He can't even lift his head and he's growling already. Not a happy camper. Even though everyone's having a laugh about Dougal's personality and how aggro he is, it actually is quite a serious situation. So normally we give it over half an hour, but we'll just go a little bit slower in him. I just don't want him to have a reaction. The problem with black snake bites is that the animals can actually get worse before they get better. Sometimes they can have delayed signs, so it's really important that we keep a close eye on Dougal and only send him home when we're 100% sure he's recovered. Oh my goodness. This is a different cat because before he was lunging at the cage and now he wants some kisses. Look at you!
Sasha's most feared patient has survived a snake bite
Oh my goodness! What a different cat.
and appears to have had a personality transformation.
He was like a wild zoo animal that we couldn't get near without sedation. Now he practically came out of the cage to cuddle us, and he is just a completely different cat. Hello, buddy.
But there will be one more test of this prickly patient's personality.
I still don't trust you though, buddy. I'm sorry.
I don't trust you either.
After your performance. We're going to be taking out his IV catheter, which is not pleasant for even the nicest of cats, so it's going to be a bit of a challenge with Dougal. We've got some sedation ready in case he decides to not play with us.
Or he does decide to play with us.
In his way, not our way. We are...
Nearly done.
1, 2, 3. Come on, Dougie. All right, just a Band-Aid. Worst is over. It's all over. I'm always happy to see my patients go home because it means that they're better, but I don't think Dougal's going to be on my Christmas card list. And I've given him strict instructions that he needs to be a good boy to his family. He really needs to keep the only friends that he's got. So, Dougal, you happy to be leaving us at Sash? Please don't come back.
Today, Dr. Peter Ritchie is heading to a part of the Perth Zoo that most visitors never get to see.
I'm on my way to see a furry little critter. I've got to be very careful because she's critically endangered and she does have very sharp teeth.
Come on in, Pete.
Thank you.
Peter is meeting primate keeper Jenna and a very special little girl.
I'm here to see Olivia for her health check.
Yeah.
So tell me how's she been going?
She's been going really well.
Olivia is a cotton-top tamarin. She's one of our 2 females. She's housed off display, meaning the public can't see her.
Come on.
There's a massive operation here behind the zoo that no one gets to see when they come to visit.
It's going to be a big day for the little monkey. Plans are underway for her and her sister to eventually be moved to a public display area. The first step is a full health check under general anaesthetic for lively 7-year-old Olivia.
The procedure today is to ensure that Olivia is in good health and is able to go into her new exhibit. We want to make sure that she's able to get around and do all her normal primate things while she's in there.
Yeah, to check she's all good for their big move.
All right, Jenna, I'll leave you to it to get them ready to transport up to the hospital.
Sounds good.
We really want to get her move on now. She is a tiny little animal and it's important we get the whole procedure done rather quickly. So I want to get things happening so we can get her back into her exhibit as soon as we can. The procedure today is a general health check to ensure that Olivia is in good health and is able to go into her new exhibit.
The team is wary of Livia's razor-sharp teeth, so she's being held in a bag for everyone's protection.
Just going to pop her head into the mask through the bag.
Peter's first step is to sedate the tiny primate.
Olivia's not too happy to see me today and she is making a bit of a noise about it. Yeah, she is just lightening down a little bit now. I can feel she's relaxing.
So just loosen that bag up so we can see what her response is like.
She's not really reacting now, so let's see what she's doing in there.
Put my hand in.
All right, here she is. All right, back under the mask. She's having nice breaths at the moment, which is good. And I can feel that she's got a nice, strong heartbeat. She's relaxed down quite nicely at the moment. Give her a few more moments to breathe in the anaesthetic to make sure she's at a nice level of anaesthesia, and then we'll get ready to do our procedures. Because these guys are such a tiny little critter and they have such a fast metabolism, they hold a very high risk under anaesthetic. They tend to lose their temperature quite quickly and their glucose levels will drop very quickly, so it's important we get this done rather fast.
Cotton-top tamarin monkeys are highly endangered, so it's crucial Livia is examined thoroughly to ensure she remains healthy.
What I'm going to do now is have a look at her from head to tail. It's rare that we get the opportunity to get so close to our animals and ensure that everything is in good working order. And so I want to make sure I don't miss anything. going to start by just having a look at her eyes. So I'm trying to have a little bit of a look into the back of her eye. It is a bit difficult because she is so small. So there's a little bit of an opacity in one of her lenses. It may just be the first signs of her starting to get cataracts forming in her eyes. And that's a normal age-related thing for many different animals, but at the moment it shouldn't be too bad. Just like us, dental disease is common and sometimes they get some bad gingivitis, but her teeth aren't looking too bad. A little while ago, she fractured the very end of this tooth here and healed very, very nicely. Doesn't seem to be any issues. And then we'll continue our physical exam. I'm just going to continue down and keep looking at everything on this side. The little toenails all look fine and her palms all look fine. Arthritis can be a bit of an issue as they get older as well. They rely so much on their arms and their legs to get through the trees and manoeuvre through the enclosure. So it's important that they're able to do that. Everything's feeling quite good.
Pete, we're just at half an hour of anaesthetic time, so we probably just need to step up the pace a bit because we need to get her awake.
No worries, let's get moving. The clock is ticking, and we know from previous procedures that we don't want to keep going too much longer than this. All right, should we flip her over and have a little palpate of the abdomen while she's there quickly? We're running out of time and we really need to get moving. It feels okay.
All good?
Yep.
Over.
My next job is to collect a blood sample from Olivia. The vein that I'm aiming for is extremely tiny and I can barely see it, so I'm relying on feel to know where it is. So I'm feeling for the pulse of her artery. I know that the vein lives next door to that artery, so I'm aiming for the vein. I can feel the pulse at the moment and knowing my landmarks, the vein should be next door to it. Hopefully I'll get it in.
If she gets the all clear, the plan is to eventually move Olivia and her sister into a public display area.
The next step is probably the most gruesome.
Peter now needs to check for the potentially fatal disease tuberculosis.
We're going to give her a tiny injection of tuberculin into each eyelid. That's to see if she is carrying the organism. It is something that primates can have, including us, and can carry without us knowing, and we can see signs of ill health later on, and it's something that we want on a screen for her protection and her safety as well as ours. Injecting it now into her eyelid. What we're going to be looking for here is if she reacts to this. If she has the organism and her body has an immune response to it, her eyelids will swell over the next couple of days, and that will be our answer. Your right eyelid. You can see the eyelid swell as I'm injecting it, but that's not the swelling that we're going to be looking for. That'll go down very quickly. It's gone well. She's looking healthy and fit, and it's time to get her back in her enclosure. Now we're conscious of time. The longer she's under, the more risk we have, so we want to wake her up. We're just going to position her inside the pet pack as she recovers.
So if she wakes up quickly.
I need to make sure I'm able to get her tube out when we're ready. So as she's waking up, we're just giving her a bit more oxygen. Because she is so tiny and has such a fast metabolic rate, it's important that she eats very quickly after this procedure as well. So once she's awake, what I'm going to be wanting her to do very soon after is to eat something that has a bit of sugar in it so her glucose goes back to normal. I know. There we go. There we go.
Now that Olivia is waking up from the anaesthetic, Peter will have to wait for the results of the blood tests and hope that there's nothing abnormal.
We've got to get a move on with the process now. We want to get her back into her exhibit as soon as we can.
It's the day after Tamarin monkey Livia's full health check. Peter has come to see his little patient and keeper Jenna.
So how's Olivia going today?
Really, really good. Olivia looks bright and alert. She came back straight away for some food and straight back into her conditioning cage.
You can definitely tell when she's happy, when she's a bit inquisitive. So it's all looking like it's really good news. Her blood tests, we've got the results back and she's all normal. Having a look at her today, I'm not seeing any reaction with her eyelids, so I don't think she's got tuberculosis. She's recovered well and looking happy, and she's in tip-top health.
Olivia will soon go on public display, but for now she'll stay in a private part of the zoo with her sister.
She's housed off display where we're breeding many different animals and housing many different animals, and part of the zoo that no one normally gets to see, and somewhere with that we're contributing massively to saving wildlife.
Hi, I'm Dr. Danny Dusek. If you love our show and want to see more amazing stories from the Bondi Vet team, just hit the subscribe button. Click that little notification bell and we'll see you for our next video.